So good afternoon. Thank you all for coming, and welcome to the reprise of the high-quality peer review, Why and How for Authors and Reviewers from the Editors of Anesthesiology. We had this in the meeting last year. It was added late. It was extremely well attended, and we were asked if we could do it again, so we're very happy to do it again. We're very fortunate to have the Editor-in-Chief of Anesthesiology, Evan Karish, as well as our biostatistician, Tim Hool, and two of our most experienced editors, Deb Culley and Andrew Davidson, present today. And with that, I'm going to let Evan get us started.
Thank you, Mike, and welcome to all of you in the audience. I want to spend a few minutes, and I will assume or hope that you are here because you understand and appreciate the value of peer review and how it contributes to the value of scholarship. And in the next few slides, try and give you a little bit more information which will allow you to hopefully convince your colleagues as well. And we really talk about this as the peer review imperative. And for example, we're all with the journal, and I think that one of the things that we very firmly believe is peer review is one of the foundational elements of the journal, of scholarly publishing, and it adds a tremendous amount of value to what we do and to scientific knowledge. I'll give you a perspective. I have no disclosures, but I have biases, and these are some of my biases. I think the future of our specialty is fundamentally dependent upon the creation and dissemination of new knowledge. Peer-reviewed content in journals is the most important source of information to support clinical practice. And that's also the view of our authors, and because we have surveyed them. And our readers also tell us that they view peer-reviewed literature, and particularly anesthesiology, as an authoritative source for their clinical practice and research information, and that our highest valued attribute is the credibility of the information that's published in the journal. And from that came our new tagline, Trusted Evidence. And we've put it out there on the top of every issue of Anesthesiology to remind our readers and remind us of what our obligation is and what we hope our product is. But all of this fundamentally rests on the bedrock of high-quality peer review. I'll share with you an interesting article that was published a couple of weeks ago in PNAS, the Proceedings of the National Academy of Science, talking about the trustworthiness of science and how the public views science. And the public view of science is that central to the progress of science is a culture of critique, replication, validation of results, and self-correction. But there's a culture, and that culture of critique discourages groupthink, it countermands human biases, and it protects knowledge by rewarding a very dispassionate stance towards the subject of science. It institutionalizes organized skepticism, and it fosters competition among scientists to challenge and replicate findings. And this is what peer review is all about. And sometimes authors will say, well, I got back the reviews and they're very critical. Well, yes, that's exactly the point, is to challenge ourselves intellectually. The public, interestingly enough, even though they have varying degrees of scientific literacy, really does understand, and surveys have shown, that the public believes that there are key signals which they watch for in terms of trusting science. And they find that, and they believe that whether a study is published in a peer-reviewed science journal is what gives them the sense to trust the information. And journals play a key role in ascertaining the quality of the scientific evidence, and it's done through peer review. Who benefits from peer review? And many people do. Many parts of the scientific enterprise benefit from peer review. It's important to understand that peer review is a component of quality control, if you will. It doesn't determine truth. It is an approximate science. It's not a perfect science, but it's very important to us and other journals in order to be the authoritative source of trusted information. Benefits also accrue to those who perform peer review. And for those people who have participated in peer review, you generally learn that it makes you a better author. For those of you that have participated in grant review committees or study sections, you find that participating in that makes you a better grant writer as well. So it's not just authors and writers who benefit, but those who are evaluating benefit greatly, and some surveys have shown that those who are the arbiters often benefit even more than those who are being reviewed. Peer review benefits manuscripts, and it benefits both the science in the manuscript as well as the presentation of the science in the manuscript. And we need both. Neither one alone is sufficient to create a scholarly publication. We look at the science, we look at the methods, are they appropriate? The data and statistical analysis, as we'll hear from Dr. Houle, are the results valid? Are the conclusions based on the results? Has it been placed in context? Does there need to be additional experiments? And is there the appropriate understanding that there may be need for further studies? Similarly, the presentation needs to tell the reader the rationale for why what was done. The aims and a hypothesis need to be very clear. We all learned how to formulate aims and hypotheses in grade school, but sometimes we forget to put it in a paper. Is there thoroughness? Is there reproducibility? Are the methods well described? Could they be replicated by somebody else who comes along and reads the paper later? Are the data clearly presented? Are they understandable? Are there conclusions, and are those conclusions based on the results that the author has presented? Is there any spin or false claims or exaggerated claims in those conclusions or the paper? Are there the right references? And is the writing clear and understandable? There's many different kinds of peer review. There's single blind, double blind, triple blind, and open are the major forms. Single blind is that you send in a manuscript, the reviewers know who the author is. A double blind system is that the manuscript is as best possible blinded so that the authors don't know who's reviewing it and the reviewers don't know who the authors are. And then there's triple blind, where everybody doesn't know anything. Even the editors aren't aware of who wrote the paper. And then there's just open review, where everybody knows who everybody is. And sometimes the comments are posted on a website, and the names of the reviewers are posted on a website as well. We can sometimes have collaborative review, and collaborative review happens when you send your manuscript around or post your manuscript before you submit it for peer review, and you listen to the comments before you formally submit it. Journals can subscribe to third-party review companies. We don't do that, and not a lot of scholarly journals do. There's Cascade, where you may send it to a journal that may not be accepted, but the journal will offer to send your manuscript and those reviews on to another journal. And then there's obviously what we call post-publication peer review, because the peer review process doesn't stop at the acceptance of an article. Letters to the editor are a well-accepted and extremely useful form of post-publication peer review. From the perspective of anesthesiology, we have a number of core values that we use to describe what our peer review process is: fairness, confidentiality, impartiality, the assessment of experts, timeliness, security, transparency, and integrity. And this is a value system that we attach to our peer review process. We want our editors aware, we want our reviewers aware, and we want our authors aware. And again, we look at scientific issues, and we also look at issues of scientific integrity, because the integrity of the scientific literature is just as important as the content of the scientific literature when it comes to the public trust in science. Last year there was a survey done on the global state of peer review, and there were almost 12,000 scientists surveyed, and they asked them a number of questions. And they said, why do you do peer review? And there were 4 answers that came back most commonly, and one is it's just part of our job as members of the scientific community. We want to do our fair share. We want to reciprocate. We want to give it back. We want to ensure that the quality of the literature in our field is and remains high. And lastly, being a reviewer is a great way to keep current, because you get to see what's going to be published before it's published. The peer review system is also, in some ways, under stress. There's been a 6% annualized growth in the submissions of manuscripts since 2013, year over year. There's been a 10% annual increase in the number of review invitations issued to reviewers, and if an average manuscript gets 2 invitations, double 6%, and that's how you get that number. It's estimated that 10% of reviewers perform half of all of the reviews. There is a cohort of reviewers who are very, very busy. A lot of scientists will review 2 manuscripts for every one which they themselves submit. This is truly giving back over and above. And it's a very time-consuming process. The reviewers said that on average they spend 5 hours reviewing and commenting on a manuscript. And this is all in a context in which we all want faster and faster review times. And every reviewer has to ask themselves a question. Do I do my own work first, or I do somebody else's work first? And it's all pro bono. Reviewers are not getting paid. They're simply giving back. But the only thing that they want is recognition from their institutions, to recognize the contributions that they are making, because there is no, until recently, accepted mechanism for doing that. There's now an organization called Publons, which allows reviewers to sign up and demonstrate that they have reviewed a particular manuscript to get credit. So let me end with telling you that there are a number of resources available for those of you that want to learn more about the subject of peer review or the process of peer review, or hints and tips. And these are all very useful. They have varying and overlapping contents, but I think if you're interested, this is a great place to start. So I thank you for your attention, and with that, I will let the true experts speak.
Thank you very much for the opportunity to speak here. First of all, who here is a very experienced reviewer? Okay, so you can. Okay, I'm not sure why you're here. Who here does the occasional review? Who doesn't do any reviews? And who's here because they want to learn how to actually write a paper? Yes. So, if you're smart and you're just beginning to learn how to do research, then if you go and listen to the people how they do the review, that will actually help you write the paper, because then you know what we want. I have a couple of conflicts of interest. I'm an editor for anesthesiology and the editor-in-chief of pediatric anesthesia. I'm also a clinical researcher, so there will be a slight slant here towards clinical research rather than basic science, but many of the principles are equally applicable to both. I'll talk a little bit about the purpose of the review, key aspects of a good paper, the structure of a review, and a little bit about the etiquette. So, the purpose of the review. The journal wants your expertise and your perspective, because we're not experts in everything. We ask you for the originality or assess the originality and the relevance of the research questions, the validity of the methodology and the interpretation of the results, but also importantly, how do those results actually fit, or how does that research fit into the knowledge that's already known, and hence how should the paper synthesise that knowledge to actually generate reasonable recommendations or conclusions by the author. We also look for suggestions of how to make the paper have a greater clarity, correct errors, consider better analyses, and, as Evan alluded to, most importantly, we ask reviewers to assess for biased language. What makes a good paper? The fundamental part of any good paper is the research question. Has anyone here ever picked up a paper and they've had no idea what the paper's about? Is that because you're an idiot? No. It's because they haven't articulated the research question. It's all about the research question. If the authors can clearly articulate what the question is, you can more or less understand any paper. But if you read it and you've got no idea what it's about, it's not your fault, it's the author's fault for not clearly articulating the question. So the first thing as a reviewer, the first thing you've got to do is you find out what is the research about, what is the question. Is there a question in the paper? If there's no question in the paper, it's extremely difficult to review the paper. You then ask yourself, is this important? Is it relevant? Are they answering a question that people want answered? Or are they asking a question where nobody cares? You ask, is it original and is it plausible? Types of questions. For qualitative research, different types of papers have different types of questions, but there's always a question. So if we consider vomiting, a qualitative paper may say, what is the vomiting experience after anaesthesia? A quantitative observational descriptive study might say, the question might be, how often do people vomit after anaesthesia? A quantitative observational analytical study might say, what are the factors associated with vomiting after anaesthesia? And if you're doing a trial, it could be, does intervention X reduce vomiting compared to intervention Y? No matter what the type of paper, there is always a question. Is there a hypothesis? Is there a clearly articulated aim which is linked to the implied question? So we tend to talk about questions, aims, hypotheses and objectives. And I always get a bit confused as to which is which. They're all pretty much the same. The questions are most important, but somewhat weirdly, we don't actually ask people to articulate their question. They ask to articulate their aim or their hypothesis, which is actually based on the question. It might be easier if we ask people to actually articulate what the question is rather than the aim, because the aim is to answer the question, so therefore what's the question? You don't always need a hypothesis. For example, in qualitative research or in some quantitative research, you don't actually have to have a hypothesis, but you do have to have an aim. The introduction is all about the what? The question. Excellent. Someone can read. The introduction is all about the question. At the end of the introduction, you should know what the question is and what the aim of the paper is. There are various ways that people write introductions. Often you can say what is known, what isn't known, what's the gap and why is filling the gap important, and how are we going to fill the gap. They're the basic elements of the introduction. It should include the aim or aims, and it should articulate a primary aim. So if there are multiple aims, they should say this is the primary aim, but then they should indicate the other aims and potentially a hierarchy of the aims. The introduction should not be a literature review. The literature review is a separate piece of work. If the introduction is long and just has a lot of words, you should be concerned. Now, if it takes 2,000 words to persuade you that the question is important, then it's likely that the question is not important. A nice, succinct introduction is a good indication of a good paper. They should be able to articulate, this is the problem, this is what we know, this is what we don't know, this is how we're going to work out what the answer is. Simple. That's why we say introduction should be 200, 300 words at the most. If it's more than that, there's something wrong with the paper. The question, the typical way of defining a question is the population, the intervention, the exposure, the comparator, the outcome and the time frame, often summarised as PICO and PICO. When you're reading a clinical research project, you should be able to discover this fairly early on in the method section. Of course, the most important part is the outcome, and that's where most papers have issues. When you're looking at the outcome, you have to ask, does it actually matter? Are they reporting an outcome which people care about? Does the outcome that they're reporting actually relate to their question? If it's a surrogate outcome, how strong is that link between the surrogate outcome and real outcomes? For example, blood loss is really just a surrogate outcome for complications of transfusion, but we accept it as a reasonably good surrogate outcome because there's a fairly strong link between the two. Primary and secondary outcomes. There should be, how many primary outcomes should there be? Well, primary, one. What does primary mean? One. I'm always amused when people say these are the primary outcomes. I feel we can't have, it's like saying you've got multiple presidents. There's only one. It's primary means one. Why do we only have one primary aim and one primary outcome? The main reason is it hangs the whole paper together. If you have one aim, one primary outcome, then that is a thread which goes through the whole paper. If people start off with one aim or multiple aims and then they sort of emphasise this one in the introduction, then they emphasise another one in the results and then another one in the discussion, then the reader sort of loses thread of the whole paper. So the main reason for having a primary aim and a primary outcome is it links everything together through the whole paper. And if there isn't that thread, then you should note there isn't that thread and ask the authors to restructure their paper and rewrite the paper to have that thread through the paper. They can, of course, have secondary outcomes and secondary aims. They could describe different aspects of the primary outcome. For example, you could have vomiting in the first 6 hours as your primary outcome, but then you might have vomiting in the first 24 hours as a secondary outcome, or nausea. Secondary outcomes and secondary aims often describe different dimensions of the primary outcome. And one reason for doing that is because what you think is important may not be what all the readers think is most important. So that's one reason why we report multiple secondary outcomes. Other outcomes could, of course, be safety economics aspects to it, or it could be a completely different question, and it might be quite different to the primary question. If there are sort of two quite different aims in the paper or two quite different questions, then you should sort of ask yourself, should they actually be in the same paper, or could we actually have two different papers here? Methods, very simple. Does the methodology answer the question? Is the experiment reproducible? Is there jargon? Is the population defined? At the end, I'll put up my email address, and if anybody would like a copy of my presentation, I'm very happy to email them to you. Is there jargon? Is the population defined? Are the interventions clearly described? Are the outcome measures clearly valid and completely described? And is the outcome measure actually valid? They're all things you look for in the methods. Is there if it's a trial, is there blinding? What's the randomisation? Is there ethical approval? Is there consent? And if the trial is registered, then you should go and look up the registration to see whether what people are reporting in the paper is the same as what they've registered. And increasingly, observational studies are also registered. So you can go up and see whether what they've reported in their study is what they said. Now, if there's things that are not, if they've sort of jiggled around the primary aim and the primary aim has become, in the registration, has become the secondary aim in the paper, then you should ask the authors why they've done that. If there are things that they said they were going to measure in the registration and they haven't reported it in the paper, you should ask the authors why haven't they reported them, and preferably they should report them. Statistics. The first part is there should be a number justification. It should be based on the primary aim and the primary outcome. The number justification should always be based on the primary aim and the primary outcome. Good papers, however, also will have some sort of power analysis of secondary outcomes as well, but not always. If it looks a bit contrived, then one simple thing to do is just to ask them, what did they tell the IRB? And just put in the paper what you said to the IRB or to the Animal Ethics Committee. The argument that the authors generated for that should be the same as the argument that goes in the paper. The statistics section should also describe how the data will be summarised, any details in inferential statistics, how missingness is managed, And was there an a priori analysis plan, and which analyses were post hoc? And as I said, have all analyses been reported? Now, an analysis plan is something is usually a fairly detailed document. It can be dozens of pages long or hundreds of pages long, where they clearly describe how data are actually going to be analysed and reported. And it's very important that you know whether that analysis plan was generated before the researchers started looking at the data. And that means looking at the data in any form. So they should indicate in the paper if there was an a priori analysis plan, and they should indicate which analyses were a priori and which were post hoc. The reason why this is important is because you want to unpick if there's what's called data-driven analysis. Did the authors actually know what the data looked like before they formulated the question? Now, this can also apply to some retrospective studies. This is an interesting problem. We published a paper a while ago where we looked at, someone reported the number of complications they'd had after a particular procedure at their institution. And they looked back over the last 20 years and they'd had no complications at all with this particular procedure. And I thought, that's really interesting. This is a really safe thing to do. But then afterwards I thought, they probably knew they didn't have any complications, and that's why they went back and looked to see if they had any complications. But they already knew they had none. If they had had some, then they probably wouldn't have bothered to go back and look to see what their complication rate is. So data-driven analyses can be quite subtle and can be quite difficult to actually pull out in a paper. So you could ask them and say, why did you do that retrospective analysis? What triggered you to do that retrospective analysis? And they may have to honestly respond, well, we did it because we knew what we were going to find. No, they won't say that, but you could ask. So what is the problem with a data-driven analysis? Well, the way that the scientific method works is we make observations, we sort of sit there and you look at the world or look at data. You think of interesting questions. From those, you formulate hypotheses. You then go away, develop testable predictions. You do an experiment where you gather more data, and then you see whether your predictions were correct, and if they are, then you generate a theory, develop a general theory, which is a model. That's how scientific method works. Now, if you're doing a data-driven analysis, what you're doing is you're basically not collecting new data. So you just go straight from formulating a hypothesis which you sort of already knew was going to be true, straight through to saying, oh yes, it is true. So there's nothing wrong with data-driven analysis, but they have to be indicated as hypothesis generating rather than hypothesis proving. The results should also indicate the setting, the dates that the study were done. It's very important that people say exactly when the study was done, when was the first patient recruited, when was the analysis done. Describe the population, as I said, the primary outcome, the secondary outcome, and the post hoc analyses. You can also look and see if there was any missingness and how the missingness is indicated. If you really want, you can add up the numbers in the tables and see whether they actually add up. It's surprising the number of times they don't. And it tends to be not because researchers are evil. It tends to be because in multiple different drafts or when they're transferring data, sometimes they make honest errors. And it's surprising how often that actually happens and it isn't picked up until the last minute. You should see whether the raw data are adequately presented, and if there are error bars, what do the error bars actually mean? Now, when you're thinking about the results, certainly in clinical research, you've got to think there are two key aspects to the results of any analysis. There's the magnitude and the degree of uncertainty and precision. Now, the magnitude, or the effect size, is often the difference between the means or medians, or it's the strength of association, or the correlation coefficient, or the odds ratio and the risk ratio. It's surprisingly often that you see papers which don't actually report the effect size. They might compare two different treatments and they say, this was the outcome in that treatment, that's the outcome in that treatment, but they don't actually ever report the difference between the two. But that is really the primary, that's what you're really interested in. What is the difference between two? What is the effect size? And then they report the degree of uncertainty or precision, which is traditionally indicated with a p-value or a 95% confidence interval. So why do we bang on and on and on about 95% confidence intervals? Why do we keep sending papers back saying, please put in the 95% confidence intervals? The reason is because compared to just the p-values, they provide a much better indication of the effect size and the power of the study. The 95% confidence interval is a little bit difficult to get your head around, and I'll come back to it, but it basically means if the true value lies outside the interval, there's a 5% chance the sampling error occurred by chance. That's not quite right, and Tim will probably thump me in a minute, but it sort of means something roughly like that. So,
B plus.
B plus, excellent, good. So why do 95% confidence intervals help? Well, if you're doing a study here and you say, well, this is the effect size, we put around our 95% confidence interval and, whoopee, it doesn't cross zero, so therefore, great, we've got a p-value of less than 0.05, and we can say there's evidence for a difference. Yes, we've got to get published. However, if that's what's clinically meaningful, yes, we've got a p-value that's less than 0.05, but the bounds of the confidence interval are actually less than what's clinically meaningful. So in fact, we've found evidence for a difference, but there's evidence for no clinically relevant difference. So if you just report the p-values, you don't actually capture that information. Of course, what really should drive practice would be if the 95% confidence interval, the lower bounds, was actually above or beyond something that's clinically meaningful. We actually see very, very few studies which are like this, and the vast majority are in fact like this, where the confidence intervals doesn't cross zero, so you get the magical less than 0.05, but there's also, when you look at it, you think, well, it's borderline whether it's clinically meaningful. So providing the 95% confidence interval allows the reader to have a better understanding of the precision and the effect size rather than just a p-value. Of course, it's all very well to say, well, here it is relative to the clinically meaningful difference, but that might be what you might think that's clinically meaningful, and some people might think that's clinically meaningful. So beware when people define what is clinically meaningful, because the reader may not actually agree with you or the author. What if the p-value is greater than 0.05? Well, you could find this, damn, greater than 0.05, not going to get published. However, if that's what's clinically meaningful, yes, the p-value is greater than 0.05, but the confidence intervals are within what's clinically meaningful, so you can then conclude we actually have evidence for no difference. And this is very useful information. But once again, if you just report the p-value, you don't give the reader the idea of that information. Of course, if you find this result, then really this is no evidence for anything, because the confidence intervals are way beyond where there could be no difference or there could be something that's clinically meaningful. So 95% confidence intervals provide a better indication of effect size and power, which is why we ask for them and why you should ask for them. But there's still the temptation to interpret the boundaries as meaning something is significant or not. And this goes to the whole problem of 0.05 and the idea of statistical significance. Now, you've got to understand that the 0.05 is a fairly arbitrary cutoff. If we use it because I asked an editor for The Lancet, I said, why do you still have 0.05? And he laughed and he said, it's convenient, but don't worry, everybody knows it's rubbish. So we use it because it's convenient. However, you should be careful, because using 0.05 as a threshold of something being statistically significant or not is a degree arbitrary. So if the results, the p-value or the 95% confidence interval is close to 0.05 or it's close to zero, then perhaps the authors should be a little bit more tempered in their conclusions. However, if they say that they're defining 0.05 as statistically significant, then they've stuck their necks out, and for the whole paper, they have to indicate whether something is statistically significant or not. So you can't have it both ways. You can say, we regard 0.05 as being statistically significant, and then they write, oh, but there was a trend, so maybe it really does mean something. You either decide it's statistically significant or not, one way or the other. There's a lot of push at the moment to get rid of 0.05 and statistical significance, which I won't talk about today, but it's very much a watch this space. We all agree to get rid of 0.05, but nobody really knows what to replace it with. So at the moment, we're more or less stuck with it. Interestingly, anyone know who this guy is? Sorry? Fisher, exactly. And where did 0.05 come from? In 1926, he was doing an experiment. He was an agriculturalist where he was spreading cow manure on different paddocks. And he decided that 0.05, why did he justify it? He said, personally, the writer prefers a settled standard about 5% point. So he chose 0.05 sort of fairly arbitrarily in a large experiment where they were spreading cow manure on different paddocks. Say no more. The other problem is the whole frequentist approach. And I'm not going to tell you all to do Bayesian statistics, but I'm going to tell you to think like a Bayesian. That sounds like a song, doesn't it? Think like a Bayesian. Sorry. So, how do we interpret p-values and 95% confidence interval? Well, the p-value doesn't indicate the likelihood of something is true. We tend to think that, but it isn't actually what it is. A 0.05 merely means there's a 1 in 20 chance of finding that result if the null hypothesis in the population isn't true. Doesn't mean there's a 95% chance it's true in the population or a 5% chance it's untrue in the population. It provides no direct information about the population, only about the sample. Using that what's called frequentist approach, it's actually very difficult to get your head around what a p-value and what a 95% confidence interval actually means. And the simplistic idea that if it's less than 0.05 means something is likely to be true is completely wrong. So how do we get around that when we're looking at a paper? Well, the answer is to have a Bayesian approach. And this is Bayes. He was, I think, an 18th century German pastor who described Bayes' theorem. He wrote it down somewhere, he died, and then someone was going through his possessions and thought, what's that? And someone thought, oh, that's pretty interesting. So it was discovered after he died, which I thought was pretty cool. Anyway, Bayesian approach is simply the strength of the evidence after the study. So the strength of the evidence in the population after the study is the strength of the evidence in the population before the study multiplied by the new evidence of the study. So this allows the author to actually give an estimate of the probability in the population rather than just in the sample. So once again, I'm saying, I'm not telling you should all use Bayesian statistics in your analysis, but you should think like a Bayesian, or the author should think like a Bayesian when they're interpreting their results. So the strength or the total evidence after the study is determined by the strength of evidence before the study, which could be effect size, the certainty, the quality of previous studies, including biological plausibility, multiplied by the new evidence of the study, which is the effect size, the quality of the current report. And you put the two together, and then that should give you, the authors, the indication of what to believe afterwards or what to recommend afterwards. And Steve Schaefer wrote a very nice editorial about this about 10 years ago in ANA, where he's basically summarised it saying, extraordinary claims demand extraordinary proof. The discussion. Now, the opening paragraph of the discussion should indicate the answer to the primary question. I find discussions a bit boring to read, but anyway, they're often the hardest to write. But if you sort of follow this particular format, it's easier to see what is a good discussion and what isn't. So your opening paragraph is saying, this was the answer to the question, woohoo. Then you summarise and evaluate the previous knowledge. You indicate how your study fits with the previous knowledge, the strengths and weaknesses of your current study and the previous study, and then you put it all together, and that gives some indication of future directions or some conclusion. Now, what is this? It's a Bayesian equation. So the discussion is basically a Bayesian equation. You're saying, this is what we found, this is what we knew before, and the quality of what we knew before, this is what we found in this paper, therefore this is what we recommend. It's a simple Bayesian equation. So thinking like a Bayesian, you don't have to do Bayesian statistics, but when it comes to interpreting your study, or interpreting the study, you should see if the authors are actually acting like a Bayesian. Pitfalls of discussions, too long, it's not a literature review, don't repeat the introduction, Overemphasis on secondary questions and secondary outcomes is often a problem in a discussion. Too much speculation, you should pull them up on, and if the importance is overemphasised. It's very tempting if you put years of work into a paper to overemphasise it. If the authors say they're the first to do something, then try and find out if they really are, because nearly always they're not. Secondary outcomes. Now, secondary outcomes are secondary outcomes for a reason. When people define their primary outcome, the author defines the primary outcome and say that is what's most important. And the secondary outcomes are secondary because they think they're interesting but not as important. So if in the paper they define the primary outcome or the primary aim, but then in this discussion they spend ages and ages and ages saying, well, if they in the primary outcome they didn't find what they liked and there was no effect, but they then emphasise the secondary outcome, then that's not really logical because they decided a priori that the primary outcome was the most important, so therefore that's what they should be discussing about. That's what they should be discussing in the discussion. Are the conclusions valid? As I said before, there should be a question or an aim, methods, results, conclusions. The conclusions should be based on the results, and the conclusions should relate to the questions and aims. So this is called internal validity. Is it valid? One thing that the paper should never finish with, what are the words that a paper should never finish with? More research should be done. If the authors write that, then please ask them to remove it. It's a terribly deflating way to finish a life's work. More research should be done. The abstract. It's often the only thing that's ever read. It must be absolutely clear. As a reviewer, you should go through the abstract word by word to indicate that every word needs to be there and everything is correct. It has to address the primary question and the primary outcome and should include actual data along with 95% confidence interval. And the conclusion of the abstract, those two sentences are probably the most important sentences in the entire paper. So they're the ones you have to focus on and make sure that those conclusions are valid, because those are the two sentences that are most likely to get read. The structure of a review. Please be clear in your language. When you're reviewing something, are you asking for clarification? If so, what and why? Are you suggesting a change? If so, why? And give some idea of what needs to be changed. Vague comments in reviews are not particularly useful for authors or editors. Be clear if you think something is very important. If you get a 5 or 6 pages of review questions, then sometimes reviewers disagree with each other, and it's useful as an author if you've got an indication of how strongly you as a reviewer feel about particular things, because that will help guide them in their decisions. The way you structure review, everybody has their own particular way, but the way I do it is I usually have a summary of the question, and you're sort of repeating what the author already knows, but it's a good way of getting your thoughts together. And also it's something nice to say to the author. You don't leap into some criticism, you say, this is what you did. Okay. Then, are there any overarching issues that you could summarise in a few sentences? Then you can have major points, and then you can have more specific points. This is just one way that I like to see reviews. So you start with the question, overarching comments, major points, and then more specific points. Be clear which part of the paper you're referring to. And if you say it's already been well described, then please provide the references. If you say it's very frustrating if you're an author and the reviewer says this has been described before or you should reference the previous work if you don't actually indicate what that work is. Avoid being overly critical just to fill space. We like long reviews, but we don't want a review to be that's really, really long just for the sake of being really, really long. If you're adamant that the paper is fundamentally flawed and should never be published, you don't have to do an exhaustive review. You can just stick to the fundamental points. Don't ever indicate if you think it should be accepted or rejected, and be honest. Your comments to the author should be aligned to your recommendation to the editor. It's very frustrating if the author gets a fantastic review, but then they're rejected, and they've got no idea why they've been rejected. If that happens, then they tend to appeal, and then the whole process goes through again. Comments to the editor are very important. The editor often uses those to guide the author on the crucial issues. Give your overall impression, key major problems and what should be done. Explain areas where you don't think that you're an expert. Be honest and say, look, I'm not a statistician, but I think there's something wrong with the stats. Or I'm not an expert in this particular outcome tool, and I think you should consider sending the paper to someone who is. Don't just cut and paste your comments to the reviewers that you give to the editors. Some people do that and it's very irritating. With your comments to the editor, you can indicate whether it should be rejected or accepted, but don't send that to the author, and indicate why. And if it's a reject, explain why. Ethical behaviour, do the review promptly, decline if you don't think you have the time, decline if you've got a clear conflict of interest, and if you're not sure, then you can discuss that with the editor. Never be rude. Deb's going to talk about this in a minute. Never be rude, sarcastic, dismissive or insulting. Imagine you're the author. Some reviewers are pretty nasty and we then have to sort of edit out the nastiness. It doesn't happen now, I don't think, as much as it used to. The paper's confidential. Try not to steal their ideas and data. You may ask a colleague to have a look at the paper, but stress it's confidential. And I think anesthesiology prefers if you discuss that with the editor first. Is that correct? Evan? Yes. So if you are going to give it to a junior to review or to somebody else to look at, then really you should check with the editor before you do that, because it is a confidential document which has been sent to you in confidence. Use simple language. Many of the authors for anesthesiology and many journals don't have English as their first language, so try to use simple language. And if you're seeing a revision, then please don't raise new points in the revision, unless they're specifically due to changes that have been made. If you do miss something in the first bit and then you raise it in the revision, then please apologise profusely for not picking it up before. Becoming a better reviewer, I encourage you all to read the comments that the editor and the other reviewers make. Who here does that? Yes, it's a great way of learning how to review. And lastly, as Evan indicated before, being a reviewer is a great way to hone your critical thinking. And if you would like a copy of my presentation, please feel free to email me. Thank you.
Thank you. Thank you, Mike, and thank you, Andrew, for that great talk. So I'm today going to talk to you a little bit about how to review a paper from a statistical or methodological point of view if you are not a statistician or a formal methodologist. I think it's pretty common as a peer reviewer to approach the peer review process from one of several points of view. Oftentimes you've been asked to review because of your content knowledge. You know a lot about this area. But I'm going to try to talk you into thinking that it's time to look at these papers from a more statistical or methodological point of view because you have a unique perspective on that. So before I get started, let me tell you a little bit about my disclosures. I've got several that should not come into play here today. I've got some software, which I'm a co-founder. I'm a consultant for a company, and I'm also the statistical editor for anesthesiology, which is, of course, why I'm here. So please keep that in mind. Okay, I'm going to talk about three things basically today. I'm going to talk about common misperceptions about peer review very quickly. I'm going to talk about an outline for approaching the peer review process from a methodological or statistical point of view. And I'm also going to try to give you a couple tips or tricks for finding common problems. These are very common errors in papers, and if you find them, the people you review for will be very impressed. And then also, I'll show you some additional help for getting recognition for your good work, because as Evan said, now there's a way to formally get recognized for doing peer review, and you should be getting recognized for it. Okay. When Andrew asked how many people in the audience did not review regularly or did not do peer review, a number of people raised their hands. And it's my experience that there's several different types of thoughts. We'll call them automatic thoughts from the cognitive literature, all or nothing thinking, minimization or catastrophizing that keep people from reviewing. Like, for example, if I'm not a Nobel Prize winner, then I have nothing to offer the review process. Well, of course, that's not true. Anyone with content knowledge and or methods knowledge is going to provide value. Evan described for us the fact that the state of the peer review system is under great stress. Journals everywhere are looking for peer reviewers to help out. And so just because you're not a Nobel Prize winner does not mean you cannot help review articles. Minimization. I see this from junior colleagues all the time. If I don't understand all of the methods, then I can't help out with any of the methods. Or if I don't understand all of the content, well, then I can't help with any of the content, or that others might be better. Science, of course, is becoming increasingly specialized. It's very rare for one individual to understand all parts of a paper. I know I don't. So I think when you approach a peer review problem, do the best you can with the knowledge you do have, and do the best you can with the things you can address. And then, as Andrew stated, be clear with the editor which parts you felt you were unable to review. The last one's a little bit of emotional. I think there's a lot of young potential reviewers who don't approach peer review because they're worried of making a fool of themselves or of exposing their ignorance by writing comments or questions to authors and being embarrassed. Well, in fact, that is almost never true. Editors are very grateful for your time. I think authors are as well. Everyone knows we need help doing this. I think a tip is if you are feeling self-conscious about a comment you have, you could phrase it in the form of a question. You could ask the authors if they've considered the following issue rather than assuming that it's true. And that usually goes over very well because then the authors can answer you honestly or actually rebut your concern. So I think in general, the idea that someone cannot do peer review because of one of these automatic thoughts is ridiculous. It's a good reason to be involved, and I think it's time to do so. And as I've been hinting, I think the way to think about this is from 2 points of view. There's content knowledge, so every manuscript has content. This is the disease state, the procedures, the participants, are they humans or animals, clinical issues that you might be uniquely aware of. How are they measuring them? As Andrew said, the outcomes, and then of course adverse events that you may be aware of as a practicing clinician. And then of course there's the methods. These are things I like to think a lot about, hypotheses, designs, etc. A good review is one that actually spends time in the intersection of these two. Just because you're a clinical trial expert doesn't mean you can necessarily do a good review of this clinical trial, because every single study that's done is novel enough where it's never probably been done before, unless it's a replication study. So the fact that this clinical trial methods, which are pretty common, are being applied to this unique problem, well, there's going to be unique issues associated with that you as a content expert who knows methods can probably address. And frankly, the intersection of those two is where journals need the most help. We need your help with content, and we need your methods expertise. So think about that when you're writing up your reviews or when you're submitting papers. All right, so strategy for methods review. Here are my 5 ideas for how you could approach the methods review. Or if you're an author, keep in mind, this is how your paper might be reviewed by somebody who's thinking this way. There they are. I won't read them now because I'm going to go into each one in depth, but it goes from the easiest part of the beginning part all the way to the interpretation at the end. By the way, I'll also send you these slides if you're interested. All right, so name the design. So Andrew warned about using jargon, and I think he's right. Writing a lot of extra jargon in papers generally makes it harder for non-experts to read your paper. But there's a couple of exceptions to that, and I think one of them is with the name of the study design. There's a piece of jargon that you could use to very efficiently communicate what type of study you did. Is this a case control study? Is this a retrospective cohort study? Is this a crossover clinical trial, et cetera? You get the idea. By using that piece of jargon, you're able to communicate quite a bit about what was done here. So as a reviewer, I try to ask authors to dig deep and come up with this jargon either in the title, abstract, or somewhere in the methods section. Again, by doing that, it allows me to access a lot of knowledge I might have about that type of design and helps me to review the paper better. As Andrew said, really great, we need to know about the aims and the hypotheses. And then if I can know what the design is, I also know some inherent limitations to it. So if someone does a pre-post design, I've got 5 biases that I already know to watch out for. If someone's doing a time series study, well, I already have a couple biases to look out for there. So, but by naming the design, you can actually train yourself to be prepared for certain things to watch out for. And truth be told, they're finite, and you can actually learn these pretty quickly. And then the last part is that every single design usually lends itself pretty well to a type of analysis. If you're doing a clinical trial, you're usually doing very different types of statistical analyses than if you're doing an observational data analysis. Those are much more complicated than for a clinical trial. So by knowing what the design is, we can find the appropriate statistical analysis. Here's some common designs. In our world, the epidemiologists have won the day. The names they use for studies are the ones we all are using. That doesn't mean they're the only ones. If you looked at a different field, you'd see different names of designs, but there's some great examples there. As a quick reference, there's two books that I think are really fantastic. The one on the right, Experimental and Quasi-Experimental Designs for Research by Campbell and Stanley. This is a classic. 1965 it was written. It's been revised 4 times, but it still contains all of the most relevant designs, all the threats to those designs, so biases, confounds, things like that, and how they can be properly used to generate interpretations. The book is short. It's something like 60 pages. If you're looking for one desktop reference, this is the one I'd recommend. The Kirk book is also quite good, but it's from a statistical point of view. All right, last idea about the methods and the design point is, if you knew the name of the design, if you knew this paper was a clinical trial or an observational study, then you could apply a reporting checklist to it. This would be like a handy aid to assist you in looking for the things you would need to know about this study. And lucky for us, the Equator Network, that's equator-network.org, is one-stop shopping. It's a group out of Oxford. And what they've done is they've collected all of the reporting guidelines for all different types of research. I think there's over 400 there now, different checklists that authors should do when they're reporting their studies. So if you're a new author, this is a great place to get started. If you're writing a clinical trial for the first time, you should look at the consort to see what elements of the consort need to be reported in your manuscript. If you're reviewing a clinical trial, yep, you should look at the consort to see what elements are there. Randomization, blinding, bias, things like that. So Equator Network's a good place to go. Of note is that in anesthesiology, we review every article for a relevant checklist. So if you submit to us an animal study, we're going to check it out for the ARRIVE guidelines. STROBE for observational research, STARD for diagnostic accuracy, and PRISMA for systematic review and meta-analyses. So as an author, if you had your manuscript ready to go with those things in mind, it's going to save you a lot of hassle on the back end. And as a reviewer, we sure could use the help to check these things out. So the Equator Network is a great place to go to find these checklists. All right, once you know the type of the design, now it's time to think about how were the variables measured? How are the ideas quantified? I'm thinking here about quantitative research. Every single construct needs to be mapped out into a number. That's just the way it works. And so how are these numbers done? Are they reliable and are they valid? This part of research we don't spend a lot of time thinking about, but it's crucially important. For example, if a clinical trial is using an outcome that the authors made up 2 minutes before doing the study, we don't know how reliable or valid that outcome is for measuring what we're looking at, or if it could be reproduced, or if there's a lot of noise in it. So reliability and validity of the measurements under study is really, really important. As a peer reviewer, I know I check all the measures to see, is there some comments about reliability? For animal studies, is a single rater marking histology? In systematic reviews, is it just one author who's looking at the evidence to see if it qualifies to be included in the study or not? Every step along the way is a chance for error, and peer reviewers, we have to check these things out. So by keeping an eye out for validity and reliability is really, really important. There's a couple of different measurement systems that we could use, but I think a real easy one to keep in mind is this nominal, ordinal, interval, and ratio. This comes to us from the social sciences from 1930s, but it works pretty well. The top one, nominal, is categorical data, and the bottom one, ratio, is basically ratio-scaled variables. As you go down the list, the data have more information in them. And if they have more information in them, they're more powerful. So if you're trying to design a study and you have to do a statistical power calculation and you can pick between one of these types of measurements, you want to go down the list. As a reviewer, I have to be really careful because if somebody does a t-test on ordinal data, that's inappropriate. T-tests require that the data are interval or higher. So if there's a 3-point ordinal scale and we're running a t-test on that, we violated the assumptions of a t-test, and I have to raise that as an issue. So as a reviewer, knowing the level of measurement of the variables allows you to check the statistical plan to see if it's appropriate. And as an author, it's good to know that so you can run the right tests. Anyway, I think this is really important to keep in mind. Okay, I was mentioned earlier about the reliability of a variable. So here's an interesting thing to think about. I talk about this a lot, and it usually goes over like a lead balloon. But the association between two variables, let's say you're correlating x and y. Well, the maximum correlation between x and y is only as high as their unreliability. So if we measure both with extreme amounts of error, we can't possibly find the two of them to be correlated. If we're looking at an odds ratio, so let's say we have an exposure variable on some outcome variable, and either the exposure or the outcome has a lot of error in it, well, then the odds ratio is likely to be very close to 1, because error tends to diminish the associations we can possibly see. Here's an example of that. It's a complicated slide, but on the x-axis is the reliability of the predictor. A 0.8 reliability is generally considered pretty good. But you can see here that if the true association on that blue line was a 2.0 and the outcome was measured perfectly, it was perfectly reliable, we would still only see about a 1.85 odds ratio if the reliability of the predictor was 0.8. So we lose 0.15 odds ratio points because of unreliability. So oftentimes when we see investigators come to us with papers and they declare there are no differences here, we didn't see anything. There's no differences in the variables under study. One of the things to rule out as a reviewer is that everything is being measured unreliably. You don't need a reason to have no association if there's unreliability in the measures. So keeping in mind how things are measured and then keeping in mind the reliability helps you make this assessment. And by the way, the easy way to check that is just to see if you can see reliability coefficients, if you can see citations about the validity of the measurements, things like that. When in doubt, I just ask authors. I'll ask if this has been validated in the past or if they have any ideas about how reliable these measurements are. Okay, which brings me to the third point, the statistical analysis plan. This is something that's getting more and more attention because we now realize that one of the reasons why we're in a replication crisis is because statistical analysis plans are being formulated after authors look at the data, as Andrew was telling us about. Let me say something that may seem self-evident to you. Ready? If the analysis is conditional on the data, we're in trouble. The analysis has to be conditional on the hypothesis. You have to pick the analysis based on the hypothesis, run the analysis on the data, and then report the results. If the analysis gets reconfigured as you run the analysis, you look at it, you include some outliers, you run it again, you try cutting the data up in a different way. The more you do that, the less the inferences mean. The p-values don't mean what you think they do. The confidence intervals don't have the proper coverage. The whole thing defaults to noise. So we need to see a priori statistical plan wherever possible. If it wasn't possible, if it's a post hoc analysis, we need the authors to declare this fact. We need to know that. So the authors need to tell us which parts of their plan were developed before looking at the data and which parts evolved after examination of the data. I read a paper last week. I thought it was really fun. The authors said that they had an a priori statistical plan, but it was the 5th analysis of these data. And I'm pretty sure this plan wasn't made 5 papers ago. So they had learned a lot about what they had seen 4 papers, and on this 5th paper, this analysis couldn't possibly be considered to be a priori. It evolved after examination of the data. There's a way to do that, but it makes it much more complicated. Okay, and as a reviewer, I try to ask myself, could I replicate these analyses if given the data? That's the golden rule as a statistical reviewer. By reading your paper, can I replicate these analyses if you were to give me the data? If I can, you've given me enough detail. If I can't, then I probably need to know a little bit more. That's becoming a bit more gray now that analyses are becoming more and more complicated, particularly for observational research. But for a basic science study, it's still true. For a clinical trial, it's definitely still true. So check the statistical analysis plan to see if you could replicate the data. If you know a lot about statistical tests, you can start to think about the assumptions. Every test has a certain assumption that needs to be satisfied. Remember that example about ordinal data and t-tests? There's a great example. So if you know a lot about what the tests need to be valid, well, then you can start to check it on the fly. This is difficult because you usually need to know a lot about what the measurement is, what its measurement properties are, and how it's being applied. So that's it. But as a content expert, if you can help us with that, that'd be really, really great. Another error I tend to see a lot, and I think you'll probably see it too, is that some authors write the same statistical plan for every paper they do. It's got sort of a smorgasbord of tests. We ran t-tests, ANOVAs, Mann-Whitney Hughes regressions, and we tied them up with a chi-square. And by the time you get done, they pretty much tell you all the tests that they could have run in the paper, in the stats plan, but they don't actually run some of those tests. What we want is the actual stats plan that was in the paper. I mean, it's not too much to ask. So look for tests that were actually just introduced, but that actually are not in the paper. Okay, here's a pet peeve of mine that is unfortunately common, and I think one that you could catch. And this is the dichotomization, already the artificial dichotomization of a variable that is naturally continuous. Let's say you're measuring, you're predicting a dependent variable or an outcome, and that variable is measured continuously. It's a scaled variable. But a lot of times, what authors or investigators will do is they'll artificially dichotomize this variable. They'll put a cut point in it into high versus low, or they'll do a median split, low or above the median split. For clinical purposes, this kind of makes sense. You're thinking about, what about people who are high in this versus low? Can you predict high people? Responder analysis, you see this a lot in responder analysis. If you take a look at the change score, people who are high in the change versus low in the change. So why would you do this? Well, you can simplify the analysis. Can it simplify the interpretation? Well, yes and no, you'll see in a minute. Some people think that dichotomizing a variable makes it more reliable, and this is absolutely not true. By dichotomizing a variable, you're not making it more reliable. You're making it less powerful, but you're not making it more reliable. And then some authors will say an optimal cut point can be used. It sure can, but anytime you put an optimal cut point from these data, you make this analysis more sample dependent. It's much less likely to replicate in future samples. So you can find an optimal cut point, but it's difficult. So why wouldn't you do this? Look at the first one, loss of statistical power. If you artificially dichotomize your outcome, you might as well throw away a third of your data. It goes back to the level of measurement. When you artificially dichotomize, now you have a variable that was ordinal or interval, and you're making it nominal. Nominal data don't have as much information in them. There's like 0 or 1, male or female, responder or not. So you lose 65% is efficient, you lose a third of the data. You can't look at nonlinearity. And most importantly, in this regard, you can't interpret scores near the cut point. If somebody falls 1 point below the cut point, they're in the low group. They fall 1 point above the cut point, they're in the high group, even though they are separated by 2 points on a 100-point scale. And it's very difficult. So let me show you this visually, okay? So let's say we've got two groups of people, the red and the blue. The blue are the diseased group, and the red are the non-diseased group. And we've got a biomarker where we're trying to separate them. And the biomarker, we're trying to put a cut point in the biomarker. That's the green line below, at which point, if you have a higher score than this on the biomarker, you're in the diseased group. If you have a lower point, you're not. The blue and the blue is shifted by about half a standard deviation to the right. So it's just a little bit higher than the red. And you can see that green line. The y-axis of that, by that green line, is the probability of being blue, as opposed to the biomarker. There's no natural cut point there. If you put a cut point there, it would be completely arbitrary, and there's no natural place to go. Now look what happens if you go to 1 standard deviation. If the two groups are separated by 1 standard deviation, there's a little bit more of a cut point, but not much. Look at 2. Now, if it's 2 standard deviations, maybe you can make an argument that right down the middle there, you can start to see plateaus on either side, but still, there's some ambiguity, so gray area in the middle. Great news is if you've got 4 standard deviation separation, well, now you can probably do it. But if you have 4 standard deviations of separation, you might as well apply for your Nobel Prize, because you don't see that very often in biomarkers. It usually means you know exactly what's going on. Okay, so artificially dichotomizing is a bad idea. As an author, you should try to avoid it. As a reviewer, you should try to catch it. Okay, reporting of results, my 4th one. Can you identify the size of the effects? As Andrew did a great job of beating up on p-values, we aren't looking just for p-values. P-values are a garnish. What we really want is the descriptive statistics. We want to know the actual data you observed. And what are the uncertainties around the findings? We want to see variability estimates, standard deviations, interquartile ranges, and of course we want confidence intervals for all the reasons that Andrew stated. So here's some common errors I think you could find as a reviewer. Look at the first one. I call this a solitary p-value. This is where the p-value is supposed to represent all you need to know in the sentence. Control value, p is less than, p is less than. There's no actual numbers in there other than a p-value. I don't know the sizes of the effects. I don't know the uncertainty in them. I just know that the authors think they differed statistically significantly. And for all the reasons Andrew stated, we don't know much in there. And this is not a good reporting style. If you see this, definitely make a comment as a reviewer. This is not okay. Let me beat up on basic scientists. Basic scientists seem to do this quite a bit, and they also seem to do it quite a bit in the abstract. And an abstract is where we need most amount of descriptive statistics, because if someone only reads the abstract, they need to see the size of the differences. All right, look at the second one, contrasting p-values. This one is pretty common as well. The treatment group was different than the baseline, significant p-value, but the control group was not. I believe this is encouraging me to look at the two p-values and say, well, the one p-value is significant, but the other p-value isn't, therefore the groups differ. That's implied here, and that is not correct. You cannot contrast p-values as evidence of a differential effect. You have to run a formal test comparing the two groups. So if you find this as a reviewer, please flag this. This is hard to see, but if you can find it, it's going to change the nature of the paper. The last one, of course, is that absence of evidence is not evidence of absence. If you fail to find superiority, you cannot declare equivalence. Just because we see a non-significant p-value doesn't mean that the two groups are the same. Oftentimes you'll see, the two groups did not differ, and you give them a p-value there. The best way to do that is to give the means and standard deviations of the two groups to show you that the two groups are actually, in fact, not different from each other. So catch those errors if you can. All right, interpretation. This goes without saying, but does the interpretation reflect the actual data? I don't know about you, but sometimes I read papers and I'm not sure exactly what the authors are commenting about, but it doesn't seem to be their data. I think the telltale for this is when the results section has references to other work rather than the current work. You can do that sometimes, but the interpretations have to be, of course, based on the current work. And you want to focus on significant findings while ignoring non-significant ones. If you see that, that's it. This is tough. So if the authors ran 100 different comparisons and they treated us with 5 of them, 95 are not important, 5 are significant, I think that's probably just error. But at the same point, that's what you see a lot in papers where they don't let us see all the inferences. They just tell us the ones they want us to see. If you knew what the study design was, you could actually see if the study design can support the interpretations. In observational research, you'll see the word prevalence and incidence quite a bit. But if the authors used convenience sampling, it's a stretch to say that you actually have the prevalence or the incidence from the population. It's convenient sampling. People who seek treatment are not the same as people in the general population. We have to be very clear about who we're talking about here. Okay. And as Evan and Andrew talked about, there's something called spin. So let me give you one of these before I close up here. Spin is specific reporting that can distort the interpretation. Isabelle Boutron has got a program of research that she's doing that is really fantastic, and she's done a number of studies. This is one of the first ones she did in 2010. And she's looking at is how often does spin occur in scientific research, clinical trials, basic science, et cetera. She's got some great discussions on it. I think I'll refer you to her reference. She explains it much better than I do. But what is it? Well, it's a focus on statistically significant results rather than non-significant results. So again, if you ran 5 things, 1 was significant and 4 were not, a skeptical reader could focus on the other 4. Here's one, within group comparisons. This is one of my favorites. We've got group A and group B. Group A changes significantly, but group B does not. Again, if you want to tell a difference between these two, you would have to compare A and B directly. You can't just say A is different than B because A changed and B did not. So a proper test of a differential effect using an interaction term or a different score or an ANCOVA would be a more appropriate approach. People tend to report to promote their secondary outcomes. So when the primary outcome doesn't go the way we wanted it to, the secondary outcomes all of a sudden seem a lot more important if one of them was statistically significant. So you tend to see the secondary outcomes get promoted in the abstract. They talk about these first. They're the ones they talk about in the conclusion section of the abstract. And it's like the primary outcome is less important. We can't allow that. Subgroup analyses. I love these in clinical trials, but I'm being sarcastic. I don't love these. The effect size worked. The primary outcome was negative, but it worked for women, but not for men. So on the fly, I did a subgroup analysis of males versus females. It worked for females, but not for males. That effect is likely to be so non-stable and likely to have been data-driven. You probably looked at a lot of different effects before you came up with that I suspect you would not replicate that effect. So subgroup analyses are difficult. And then the last one, that one's tough. If you don't see statistically significant results, they're not equivalent. So we try to show superiority between a new drug and an old drug. We failed to find superiority, but then we say, okay, but the two are the same, so that's great news, right? Well, the truth is we have to show equivalence before we can make that comparison. The last one's for just flat out fraud. There's been a few instances of that in the literature, but we haven't seen that in our journal, luckily for us. So, how prevalent is spin? 61% of the articles that they looked at had spin. Look at that, beginning in the title. So the authors are trying to spin us beginning in the title, which is really interesting. Okay, let me close here at the next steps. If you're a new reviewer, there's something called the Publons Academy. This is a really neat program. You can sign up and have a mentor. So someone from the Publons group will actually mentor you while you do your first review. They'll do a review with you, and so they actually get you formally invited to do a review. They'll do it with you, and they'll submit it with you, and they've got training right on the site. I highly recommend this. This is a really neat way to learn how to do peer review. After you do that, of course, or while you do it, you should create yourself an account, reviewer profile. It's easy to do, it takes just a couple minutes. Publons has partnered with Web of Science, so they actually can be one-stop shopping for your publication impact as well. They now have H-index, I-10 index, the amount of reviews you do, the number of citations you have, et cetera. It's really neat. And of course, Anesthesiology actually has partnered with Publons in that we send them reviews. So take a look at this. When you go to submit a review, the first box you see where the blue check mark is there, is you could click yes. So by completing a review for Anesthesiology, the review will automatically be sent to your Publons profile. So if you're a member of Publons, they'll actually credit your account for performing a review. So for the first time ever, you can actually perform reviews, get credit for it, and then you can show that to your chair people for promotions, et cetera. It's a neat system. I think it's long overdue that we recognize people for completing peer review. Here's our own Alan Sampao. He's on our journal team. This is his Publons profile, and you can see what it looks like there. He won an award this year for completing a lot of reviews, so congratulations to Alan. If you're interested in those slides, let me know. Thank you very much. Should be good. Thank you, Jess.
Thank you. Boy, it's getting late in the day, late in the afternoon. How many of you have never written a manuscript? Whew. Good. How many of you have ever gotten a nasty review back? Yeah, they happen in all sorts of circumstances, and I will never forget one grant review that I received as a very young person, and it said explicitly, Dr. Cully should remove this line of thinking because anesthesiologists have a hard enough time getting respect. She should not be challenging the anesthetics that we use. My thoughts as a very young person were, I think the cardiologists look at their drugs that they use. But had I been a different person and didn't have a mentor that said, they don't know what they're talking about, that might have been an end to a career. And the same type of thing can happen to individuals with regards to peer review of their manuscripts. So I guess this is basically going to be about how to keep things objective and yet positive. So I have a couple of disclosures. Fortunately, I have some funding, man. There's just nothing better in the world than funding. I am an executive editor for anesthesiology, and I have a couple of other roles in the world that really don't have that much of a relationship to this talk. When we talk about what civility is, it's basically trying to be a nice person. No, I'm not always civil. We'll talk about that a little bit more a little bit later. But it's the kind of thing or the way you'd like to speak to someone politely in the course of your average day. You know, do you really want to walk up to that person who says, what are you doing today? And I really don't like you. No, you want to walk up to that person that says, hey, Deb, how are you today? What you been up to? I really enjoyed your talk. Those types of things. And the same thing can be said for reviews. It's a difficult process. It's really hard to be rejected. So we need to come up with a way to do it so that it's not so offensive. At anesthesiology, we pride ourselves in our formal reviews. We pride ourselves in improving the quality of the manuscripts that we read. But we also hope that we're being objective, fair, and unbiased, because it's really easy to have bias enter your review. Have you ever woken up on the wrong side of the bed and just decided you were going to be a little nastier today than you were yesterday? Have you ever gotten out of your car and almost have somebody hit you on your way into work just before you're going to do a review? Do you think those types of things might affect what you're going to do? So make sure that you know where you are in your space and time so that you can avoid potential bias. Our authors, the people that you're reviewing every single day, are your colleagues, your friends, your peers, and your most fierce competitors. But most importantly, they really are the lifeline of the journals. We all really need to recognize that without authors, we don't need reviewers, editors, or journals. You are the lifeline of the journal, and eventually you're going to become the reviewers and editors. So we'd like to keep things civil. But I am Deb Cully, and I do things wrong sometimes. I have written the nastiest reviews, and gosh, thank goodness for Evan, because every once in a while he'll say, "Hey, Deb, did you really want to say that?" No, Evan, I didn't. I might have gotten up on the wrong side of the bed. You know, things like that do happen even when you're reasonably experienced. I've made mistakes in my reviews, and the authors catch them, and then I have to apologize profusely for having made a mistake. That doesn't feel very well. And I seem to be a master at making really influential people angry by rejecting their articles. But one of the ways you can kind of get around that anger is this thing called a telephone call that just says, "Hey, you know, I'm going to reject your article," but in a kind way, letting them know basically what the things that they could do next time to try to make things better. Worst of all, the worst things I've ever done is reject manuscripts that I knew were going to go someplace else and be well cited. So if you invite one of these really awesome, well-cited authors, they every once in a while will send you in garbage. You know it's going to be cited garbage, but because the quality wasn't there in the manuscript, you've got to reject it, and then it goes to some other journal, and they get all the points for the solicitation of the article that you tried to get. I would prefer to see the review process a little journey that authors, reviewers, and editors take together. That we would treat one another as if they were treating us, or the same way we'd like to be treated. To write polite reviews that are factual, honest, and helpful. Saying this is a piece of garbage really doesn't help anybody. They don't know what part of it's a piece of garbage, but if you explain, you really didn't provide us with a hypothesis, that's a little bit more helpful. Try to use a tone that's not personal. It's sometimes hard to do and remain objective while recognizing that the authors are the journal, and without them, as I said before, we wouldn't need one. Try to figure out whether or not it's publishable. Tim had mentioned this earlier on, I think, or maybe it was Andrew. If it's not publishable, identify the flaws, describe them politely, and move on. There's no need to write, 10 pages of discourse on something that you're not going to accept. But there's another philosophy, and that's that if you actually think it is eventually publishable, do everything you can to help the author get to the point that you're going to publish it, and try to do it on that very first review. I'm not perfect at it, but the goal should really be for us to give them the guidance so that we can get to yes, which in our world means accept, not revise and reconsider. The other thing that's really difficult is when you're an author and you have put hours of your time, energy, emotion into what you just wrote, it's really difficult to get constructive reviews. And I will never forget my first review from an anesthesiology journal. It wasn't this one, so it's okay. But that article was torn to shreds, and I was very new and very young, and it said revised major, and they might as well have just said, "Hey, we just threw this in the garbage and you are over, lady." Fortunately, I had a mentor who saw the revised major, and he said, yes, it's accepted. All you got to do is play with it a little bit more. But it's really hard to recognize that. So if you're inexperienced or you're really experienced, pay attention to the guidelines or the guidance that your reviewers and editors are trying to provide you. If they put it as a revised major, they want it to get in eventually. They really want you to clean it up so that we can take it and we can all move it to another position. Respond to the reviewers in a positive tone. You can't imagine how nice it is when you hear somebody say, you know, I'd like to thank the reviewers for their review of my article. But there are other things that every once in a while you hear, like, Deb Culley, are you a moron? They don't usually put it quite that directly, but it's kind of how you feel as a reviewer. So I'm going to review your paper. You just told me I'm a moron. That's kind of like getting up on the wrong side of the bed. Might not be as positive as you want. So make sure that you try to say something in a positive tone. Be introspective with regards to the type of reviewer you want to be. This is a really nice graphic about confident people and insecure people. And confident people are open-minded, willing to consider new ideas, accepting of criticism from others, in particular when it's constructive. But the insecure people are closed-minded. They make excuses for everything. Oh, that editor or reviewer is just horrible. But it doesn't really matter if you're the editor, the reviewer, or an author. You really need to be introspective so that you can really do the type of work that you want to do. I think one of the hardest things that I've ever had to face in my life is probably now 15 NIH R01 grant application rejections. There's just nothing worse than getting a score of 37. What it says to all of us is we're not good enough. And when we get our manuscripts reviewed and we get a rejection, we oftentimes think it's because we just aren't good enough. Remember, it's not you. It's not personal. You were not rejected. Your manuscript was rejected, but that's not who you are. And so don't take it so personally. You know, stand back up and move forward in the right direction. And in the end, I would say that every time I thought I was being rejected from something that I really wanted was really good or was the best paper I'd ever written, I was actually really redirected to do something that was even better. It's the manuscript, not you, the person, that's going through the process. And when you are allowing yourself to kind of give up the idea that they're rejecting you and change it to the manuscript, man, you feel free about it. You can say, yeah, fine, okay, you didn't like my manuscript, I'll learn from it and I'll do a little bit better next time. I think the other thing that we need to talk about is this thing called respect. And that goes for the reviewers, and I have written some really nasty reviews. I will totally admit it, and people have had to clean them up for me. I've also had to clean up reviews from other people. So it's my way of saying to you, if you really have to write something nasty in a review, we're going to take it out. Because we really want those people to come back as authors and really contribute their work to the journals. So remember, we're all in this together, and it's a common street. The other thing I see frequently are reviews that say things that even I can't understand. So you're trying to tell the author to improve their paper, but the communication really isn't very clear. Try to be clear. What are you looking for? Things like, the authors really didn't do a great job of describing what the project was about. No. What you're asking them is, could you please provide me with a very clear hypothesis? People think those are saying the same thing, but they're really very different. And most of us have had these manuscripts that come in, and you think it's wonderful, and it's submitted, and to you it looks like your beautiful little car. But by the time you go through your minor revisions, the changes of your introduction, the changes of your methods, because the statistical reviewer says you should do it a little bit differently, even though you had your own a priori statistical analysis thought out in your head, you just have to recognize that sometimes things are going to change, and they never seem to look exactly like they did when they came in the first time. I think the big goal here is to recognize that you are in your pathway to success. If it doesn't happen this time, it'll happen next time. And the key to this whole process, if you're going to be an academician, is to really enjoy the process, enjoy the journey, and recognize that your peers are here with you to help you become successful. And with that, we'll open it up for some questions.
I want to thank our colleagues for some fine presentations on peer review and its importance in medical research. And we've deliberately allowed a lot of time for discussion. If you have comments or questions or anything about peer review in general, or the peer review process at anesthesiology in particular, please feel free to bring them up. The mics are available in the front of the room, please.
Can I ask one?
Yes.
My question is for Tim. How are you? Nice to see you again. I personally have had a manuscript that I sent into the journal.
Into the mic.
I have personally had a manuscript that I sent into the journal, and I got a really lovely statistical suggestion to modify the statistical analysis such that it was no longer the statistical analysis we had said we were going to do. We did it. We got even prettier results, which is always a nice thing. But I didn't acknowledge in the manuscript that the statistical analysis had been changed based upon the reviewer's suggestion. How should that have been handled?
So thanks, Deb. Yeah, if you've listened carefully, you've heard us say kind of two things simultaneously. One is that you should have a preset analytical plan, and the other is that you should listen to the reviewers. And sometimes people ask for changes to the analysis plan. So a predefined plan, we may discover, or the reviewers may think that something needs to be done because it threatens the paper. The analysis is in such a way there's a threat to it that we could be addressed if a slightly different analysis was done. So under those circumstances, I or another member of the team will make a suggestion and say, could you modify your analysis? That's dangerous because the reviewer is no longer naive to your data. We have reviewed your data, and therefore the analysis suggestions are being made partly based on the data. So that makes the choice of analysis conditional on the data, not on the hypothesis, which is what we're trying to avoid. So as Deb just said, the tricky part here is, and how do you make sure that you protect yourself from that? Well, the best way to go is a sentence we always recommend, which is, in response to peer review, the following changes were made to the plan of analysis. And this hopefully identifies for the reader as well as for the authors later on to remember what parts of the analysis were in fact post hoc, maybe even worse than post hoc based on an evaluation of the results. So it's tricky, but we do it rarely, but it will happen, and I think that's a great way to do it. And if you add experiments in animal studies, we suggest the same thing. You comment about that in the paper. So I hope that answers the question.
Thank you.
Good question. Thank you. Please.
That was a terrific presentation, and I think I would agree with everything you say, and I accept everything you said without revision. The challenge, except for Debbie's it sucked. No, I'm just kidding. One of the challenges that I frequently have in the course of writing a manuscript is on the topic of self-plagiarizing the method section. So you've developed a method for doing your experiments. You've written it in a manuscript as best as you can. But by the time you've used that method on your 10th paper, you sort of wind up with it, and you can't really reword it any way to avoid self-plagiarism other than simply referencing your previous manuscript or often manuscripts. But that leaves the reader in sort of a funny position that he now has to almost do his own research, going to the library, finding this manuscripts to understand what your methods were in order to contextualize your data. Should we be rethinking the concept of self-plagiarization within the method section as opposed to other parts of the manuscript? And Evan, let me sort of direct that towards you.
Yeah, it's a really good question, and it's a relatively common one. And there is no question that plagiarism of results and data and the more the guts of the results of the paper is unacceptable. there are only so many ways that you can describe how you made a peanut butter sandwich before you start to repeat yourself. And different editors will feel a little bit differently about this. I have less of a problem with describing what you did in a way similar to the way that you described how you did it before, if in fact you did it the same way both times. I know some journals are extremely prohibitive of that. I think there are more important things to pay attention to. If you've done something again and again, I think it is appropriate to simply say we did this exactly as we described it before, or we did this exactly as we described it before with the following modifications. If you want to repeat the verbiage again in great detail, there are some ways where you can mix it up a little bit. You know, I put the jelly on first this time, I put the peanut butter on first this time, and then I put them both together. It's still a peanut butter and jelly sandwich. But I'm relatively less spun up about repetition in method sections.
Lauren?
Thank you so much for really, really terrific presentations. One of the things that we heard from you all is actually from Dr. Cully, is the idea that sometimes if you wake up on the wrong side of the bed, maybe you should wait a little while before you write your review. So the question I have, so there's this idea that we all go into the review process maybe with some degree of bias, good day, bad day, whatever, but we're able to control that. But one of the sources of bias that I think is extraordinarily difficult to control is when we get a manuscript to review and you look at the author line. I mean, you might say, you know what, I'm going to try to be unbiased today. I'm not going to look at who wrote this paper. I'll just do the review, and then when I'm done, I'll look at the author line. But it's really hard to do. And I don't think too many of us do that. And to me, I think that's probably one of the biggest sources of biases. You look at the author line, you know, these people are a very, very well-established group. They have 100 publications. Somebody else, not as well-established, another type of bias. And my question to you is, and I'm sure you've considered this, is what about double-blind? What about triple-blind reviews? You know, you don't look at who, you know, the reviewers, the editors, no one looks at who the authors are until you've made a final decision.
I think it's a great idea. I try not to look at the author list, but the reality is, if somebody writes a paper and includes in there, as performed in our previous publications, well, you go down and there's the list of authors. So I think it's really, really hard to blind somebody completely from who those authors are. You're at least going to have an idea of who they are based upon the area you're in, and that's particularly relevant if you're a reviewer of something that's you're a content expert in. So I don't know of a really good way, but maybe Evan does.
No, that's why I put up the slide about single blind, double blind, triple blind. And there's been a lot of research done about the mechanism of blinding or not with regard to reviews, and there's a whole field of science that has looked at that. I think that the concept of double-blind reviewing, in theory, has some value, but anybody who's gotten a double-blinded paper to review, the first thing they do is work their tail off to figure out who wrote it anyway.
Huh.
And that's sort of just human nature. I think, let me respond to your question, Larry, in a slightly different way. And I posed a challenge to our editorial board in a meeting one time with the following question. If we get a manuscript from famous professor Dr. So-and-so, who's published 10,000 manuscripts and is known throughout the galaxy, should we be a little tougher on that person because they are so good and we should expect so much more? Or do we give them a little slack because they're famous and after all, they are who they are. And it was a very interesting conversation. And the more or less consensus answer was neither. We assess the paper.
And sometimes when you have to reject them and you know they're going to go someplace else with a really high impact factor, it hurts.
Can I push back just a tiny little bit?
On Deb?
On both of you. So
Push back all you want.
So there are journals in the health policy arena, so medical care, health services research, health affairs, who do double-blind reviews, and they say, look, don't cheat, you guys, you authors, okay? We don't want to know who you are, so you can't say, and as I've previously done in my previous work, and it seems to work for them. And I guess where I'm pushing back is maybe there needs to be a study, maybe a pilot study, where you do a cohort that are double-blind and a cohort that are not, and see if the publication record of the authors has an impact on whether they're accepted or not. I just pushing back just a tiny little bit, but thank you very much for your response.
Before you go, my thought is that I'm always very gratified when I invite a content expert to review a manuscript and they respond and say, I would love to review the manuscript, but I'm a serious competitor with these investigators and I cannot be unbiased. And they decline the invitation. And if you're ever in that situation, by all means, decline the invitation if you don't think you can prepare an unbiased, single-blind review. Anyway, good point. Thank you very much. You were up first. Go ahead.
Yeah, thank you for the presentation. And I have the question, which is kind of two-sided. It's about the data that was analyzed in the study.
Could you step back from the mic just a little bit?
Yeah, sure.
That might work better.
So does your journal require the submission of the raw data? And and the data analytical code or any other steps of data analysis? And if yes, and what are your thoughts? Is it required, do you think, or should it be the direction to go? Or, and if yes, so my question to actually, first, how would be, what is the better way to submit this? Because I saw all different ways to do it, like HTML file, GitHub repositories, different ways, and how to review it. Like replicate the code, run the R code. What is your idea on that?
Go ahead. Yeah, so great question. So my understanding of what you were asking was, does the journal require or encourage the submission of raw data or statistical code for replication? And in terms of raw data, we do not. I think the entire publishing field, all of academic science, is rethinking this idea, and I think perhaps in the future people will be moving towards that. But for now, we do not. So we do not encourage, nor do we accept raw data. Occasionally, raw data will be requested if fraud is suspected, because we need to double check some things. But under normal operating procedures, we do not. In terms of statistical code, it's never considered a bad idea if you're doing something unique. So let's say you have a new algorithm for processing something, and it's written in R, and no one else has access to that. It's going to be very difficult to evaluate your manuscript without that code. So in that case, submitting it as an appendix or supplemental content, it would be a very good idea and would help the reviewers get in touch with your manuscript. We will not be trying to replicate your analyses. We just don't have the resources to do that. But the code will be neat to see. We trust that analyses that are submitted to the journal are valid, and that we take your word for it as an author that you've tried to replicate it and the code is running, et cetera. But occasionally a reviewer will try to replicate it on their own, but that's not done through our team.
And if I, as a reviewer, say that I cannot replicate all the steps of statistical analysis, does it mean you reject the manuscript?
Great. So you, as a reviewer now, you're approaching a manuscript and you're reading it, and let's say a power calculation you can't replicate, or you see an error in the t-test or a confidence interval. By all means, that's the time to throw the flag. Tell us you found a problem and make that a center point of your review. That's always welcomed, because that, unfortunately, is very common. So help us out with that. We'd really appreciate that. So thank you for being vigilant.
We do sometimes ask for analysis plans, and it's good science if you upload your analysis plan onto a publicly accessible place. The journal tends not to publish analysis plans, but if you're doing a trial, it's good science to put your analysis plan on clinicaltrials.gov or something like that. But I agree with Tim that the whole field of who has access to data is about to change substantially, and the journal will change as appropriate.
All right, thank you.
Thank you. You were up next.
Thanks very much for a really informative talk, set of presentations. As an author, it was really useful. My question is, how does the process of becoming a reviewer work, and at what stage in your career is that something to think about?
So what is the process about becoming a reviewer for anesthesiology, and at what stage in your career is it appropriate or welcomed? I think that's your question?
I'm sorry. Yeah, so at what stage how does one become a reviewer, and at what stage do you think about that?
Do you have a mentor?
Yes.
Does your mentor review?
Pardon?
Does your mentor review?
Yes.
You might want to talk to your mentor about reviewing with that individual, because they're usually very experienced and good at it. The first couple of reviews I did with one of my 3 to 5 mentors, and learned a lot as a result of it, and then you kind of have an idea of a direction to go.
Okay.
Yeah, and to that I would add that if and when that happens, have your mentor indicate in comments to the editor that you facilitated or you did the review, so that you become known to the editors as a potential another reviewer in the future, having gained experience. Does that make sense?
Yep.
Okay, good.
Thank you.
I also refer you to the Publons Academy as well, if you're interested in that, because they have a lot of reviewing.
Do you get paid by them?
I do not. I get no money from Publons.
So you were up next. Go ahead.
Okay. I have a question specific in the review, like revision stage of our manuscripts. And also you tend to, well, at least that you tend to agree with the reviewer and make the maximum you can do to respond or following their suggestions. But occasionally, you will have some comments that you just simply just disagree, or you have some question mark. Does the reviewer really understand what you're talking about, what they are talking about? So my question is, in what situation you would suggest as an author to fight back, to just explicitly say that I disagree with the reviewer, and in what kind of situation you will suggest us to even complain to the editor? Is it possible to find another reviewer or not?
So let me summarize. The great question. So I think the idea is that generally you accept a review and you acknowledge that the criticisms are valid, and you've got a pathway for that. You're going to address those concerns. But there are times when you disagree with the concerns, and you want to know what is the best way to politely rebut the concerns, or to find a way to push back on those concerns.
Correct.
So I think that's a great question. I'll start. I think the best way to do that is, of course, one, start off with being polite, as Deb was stating. Everyone has tried to prove your paper to the best of their abilities. Becoming defensive with your language, et cetera, is always a bad idea. But closely then related would be, I think everyone responds to facts and data. So if, in fact, one of the reviewers has misunderstood what you've done, helping them understand why they're incorrect on their assessment would be really key. If they're correct on their assessment but wrong on the conclusions, well, then I think at that point you'd have to show us that, including using data. But it's not uncommon for authors to politely push back on comments, because usually there's a lot of comments to address. So that's completely fair.
Yeah, I think it's entirely appropriate to respectfully disagree with a reviewer. But if you just have a cogent argument for why you disagree, that's fine. Do do pay particular attention to what the editor says, because if it's a good review, then the editor will be guiding you as to what is most important, and be slightly more careful, respectfully disagreeing with the editor.
The worst mistake I see in people's responses to points raised by reviewers with which they disagree is to not respond.
Yes.
It's the worst thing you can do.
That's a
Yeah, you need to respond and explain why you disagree with them and provide evidence as they've suggested. Good question. Thank you.
Thank you.
You're up next.
Yeah, this has been a great panel. Thank you very much for some excellent talks. My question is about peer review. I've noticed that I think the BMJ and I think some of the BMC journals are actually publishing the the questions that reviewers have and the responses that the reviewers write back to the journals for 1, 2, or more iterations, depending on how many goes around it has. I'm just wondering about your thoughts on that and whether, as a journal, you're interested in doing that as well.
My thoughts. I think I agree the BMJ does it. It's not anything that I think we're going to be doing in the near future. That kind of open conversation has been an approach that has been taken by some journals. It's not a common approach. I don't think it's an approach that we would be taking in the near future.
All right, thanks.
Okay. Thank you. Sir.
So I would like to congratulate the editorial board members who worked really hard to raise the journal impact factor, making it one of the best journal in our field. And as you appreciate, that there is no limit for improvement. The sky is the limit for improvement. My one small comment is, will you consider to sending out a letter to the editor for the formal review process? Because it's a lot of work, a lot of literature search to write a letter to the editor criticizing a paper already published. Then all we get is just a 2-sentence comment, a reply that unfortunately your letter is not accepted. So we'd like to hear that why and what is the criticism, why this criticism of the criticism is not appropriate and what is wrong and how can we improve in the next letter.
Sorry, we have trouble with the hearing.
Yeah,
but
the acoustics are bad.
I think the first part of your statement I missed. I think you were commending some people. I didn't hear that. Second part, though, was...
Are you recommending peer review for letters? He wants peer review of letters to the editor.
Peer review of letters to the editor. Okay. Peer review of letters to the editor, some feedback on why a letter might be rejected in terms of how it might be improved. Okay, good question.
Well, I can't speak for journals writ large, and I don't know how other journals do this. I know all of the letters to the editor that are submitted to our journal are reviewed by a member of the senior editorial board, and they do undergo that peer review. Sometimes those letters are accepted when they're submitted. Sometimes they are sent back for some revision, and sometimes they're accepted, very much like manuscripts are.
We don't expect that all letters will be accepted. Just my comment is if there is any consideration to send these letters for formal review, so we can get it like any publications, any manuscript, we get a review from the reviewers. So instead of when the reviewer comment, only for the editorial comment that this paper is not accepted for publication, just wondering if you have any consideration to review this and give us a feedback why this particular criticism is not approved.
So treating a letter as if it's a regular empirical submission, get the peer reviews on the letter, and then submit those reviews back to the author. I think that's what you're asking for. Is that a good idea?
Correct, yes.
Yeah. So in fact, we would actually apply the standard peer review process, and then I think what you're thinking is then it would give you more information about why the letter was not accepted, rather than just an administrative, this isn't an appropriate letter. So I think that's a good concern. I don't know.
Yeah, I think that as I had described before, we ask a tremendous amount of our reviewers. And the time and energy of reviewers is a precious resource, and we calibrate the ask of the reviewers and the review process to roughly approximate the size of the submission. So our full manuscripts get a fuller review than our letters. Our letters are reviewed by a senior member of the editorial board. Our manuscripts are handled by one of our senior editors, and they then in turn may or may not ask consultant reviewers to review that document. But in part it depends on the size and scope of the submission that we receive. So our resources, which are our reviewers' time and energy, are directed towards the kind of submission that we receive.
And to that I would add that it depends on the type of letter that you receive. In anesthesiology, our letters mainly relate to the content that we published, whereas in other journals, there are actually really original submissions, junior size, small size, and they get a different kind of review and deserve a different kind of review than the letters that we get. Is that correct, Evan?
Yeah, yes. Anesthesiology publishes correspondence, and those are letters. There are some journals that publish original research, but in the form of a letter. We don't publish those. Our letters, if you will, are truly correspondence about a published manuscript or correspondence about a separate or freestanding idea, but we are not publishing original research in the form of a letter. Journals that do that may send those, and sometimes they call them research letters, send those research letters out for peer review.
Okay.
There's somebody over there.
Please.
So two questions for Dr. Hoyle. The first of which is, it seems that the journal has been engaging your services earlier and more frequently in manuscripts that have been submitted. And so I'm curious for the audience to know, when does a manuscript undergo a statistical review by anesthesiology? And a follow-up question is, for one of the issues I have as a reviewer and for other journals is that they don't have statistical review that is as reliable as we have in anesthesiology. And if you do see a problem with a statistical method but not being a statistician, what the best way is to engage the editor for a more robust statistical review than may be normally found in that journal.
Great questions. Can I start with the second one first?
Please.
Okay. So I think in the late 90s, there was a survey of medical journals, and it was found that roughly 25% of journals had statistical reviewers, dedicated reviewers, which was pretty low. I think that number has gotten higher probably every year. Certainly all the Tier 1 journals have statistical reviewers. The great majority of the Tier 2 journals do. And there's even now some Tier 3 journals that have them. I don't know what the number is, but I bet it's greater than 50%. But that being the case, it's still almost half the journals don't have statistical review. So as a reviewer, it's difficult, or actually it's challenging to know that when you review for those journals, you actually have to keep an eye out for the statistical and methodological issue, especially if you care about the community. And I think that's one of the reasons why having people like yourself review is so important, so you can do that. I think the best way to get an editor to pay attention is to actually highlight the importance of the problem. I'm going to say something that I'm not sure is true, but I fear it is. I think a lot of editors don't want to see that there's a problem. I think as long as they publish an article and no one embarrasses them about it, it's just allowed to sit and lie. It's okay. The article's there, and no one wrote it up as an example of how not to do things. But I think as a reviewer, if you could highlight, look at this statistical test is being used inappropriately. These conclusions are likely to be invalid. Or this is likely to end up to get us on the New York Times front page because it's so inappropriate, something like that. Anything you can do to draw the editor's attention to it, I think, is great, because I do think a lot of journals do have small budgets to get statistical reviewing on the fly. They can actually get some reviewers in. So I think that's what I would recommend, is sort of be catastrophic in your private comments to the editor to draw their attention to the problems that you've identified. Okay. For statistical reviewing for anesthesiology, we're really lucky to have a supportive team who think the statistical review is important. So what Evan and the editors will do is they'll do the desk triages. The editors will then will sign reviewers, and then once the reviewers come back and it looks like the manuscript will survive the first round of review, then we tag in a statistical reviewer to review at that time. So it's that point. So it should be, if your paper is likely to be accepted, you should receive a statistical review on the first submission. I think that's fair.
Yeah, that's correct.
We're having, like most journals, we're having a hard time in doing those timely. So unfortunately, that has added time to the turnaround of your articles. We're trying to reduce that, but unfortunately, it does take time to do those. So if your article is being taken seriously for publication, for acceptance, then you'll get a review on the first submission. And I think that's something we're all pretty proud of, and we'll try to get you constructive criticism as quickly as we can.
And because of the time issue, one of the things, excuse me, we're going to start doing is notifying authors if their submission on the first round has been sent for statistical review after the handling editor has made a decision on it that justifies it going forward for statistical review. So you should be alerted to that fact going forward now. We hadn't done that up until recently. Other things? Other questions? All right, I want to thank you all for attending. I want to thank you for doing reviews for anesthesiology and the other journals for which you review, and thank you for submitting manuscripts to anesthesiology.
Send us your manuscript.
Thank you very much.